This is Erica Spicer Mason with Becker's Healthcare. Thank you so much for tuning into the Becker's Healthcare podcast series. So today we're going to talk about flexible membership medicine. And joining me for today's discussion is Wayne Lipton, managing partner at Concierge Choice Physicians. Wayne, welcome to the podcast. We're so glad to have you here with us today.
Thank you, Erica.
So to get us started, would you mind sharing just a little bit more about yourself, your role, your organization, whatever you think would be helpful for our listeners to know?
Fine. Well, as you heard, I'm the managing partner of Concierge Choice Physicians. I founded the company almost 20 years ago, almost to the day 20 years ago, actually. And we've been working with physicians in 28 states over this period of time. A lot of larger entities now are becoming interested in concierge. My original background was in retail pharmacy for about 20 years. I also worked with IPAs and practice management in the 90s. So I've been effectively working in healthcare for quite a long time. Originally, I began to work in the full model of concierge care and then decided to open up the company in 2005 in reaction to what the limitations of the full concierge model was. So I'm going to start off by just describing the differences between the types of concierge models that exist. The full model of concierge is one where patients pay an annual fee to participate in a practice. By doing so, the number of patients is reduced. The practice can be far more built on relationships. It's much more of an old-fashioned approach to healthcare. Oftentimes, it's limited to about 600 participants. It doesn't prevent there being some small number of patients who could be comp-type members or paid or non-paying members, but basically, it's designed to be for all patients. When I started working in that model with another company, I envisioned the possibility of having a partial model because I had read in a government report, I think it was around 2005, that there were about 100 and something practices in the country, of which a significant portion were doing it on a partial basis. When the opportunity came about, I decided to open my own management company to allow for that type of a model. And I coined the phrase hybrid care or hybrid concierge, where patients would not be required to pay an annual fee, but would have the option of continuing as a traditional patient or becoming a concierge patient. It was really the first big move into that model. And we thought that it had particularly good opportunities to expand the number of practices that could participate, considering it's pretty dramatic to say to a practice of a couple of thousand patients that you either have to pay or get out. I didn't like that very much. But initially, this was for primary care, family physicians, internists. Over time, we realized that it could be applied to certain specialists, those who were not doing pure episodic care, but rather ongoing care. And so we started offering it to cardiologists and GI docs and really a whole cornucopia of specialties, but those that had ongoing care. And also initially it was for smaller groups, independents and smaller groups. Now it's becoming very, very important to much larger groups. And we'll talk about that later as we go on through the discussion. And one of the reasons it's now possible for larger groups and hospital-associated groups to do this is that in hybrid care, it is consistent with what has been the vertical strategy that exists in these larger groups and hospital-affiliated groups. So that's a little bit about how we got to where we are, but our company is one of a small number of companies that offer this type of marketing and support. In fact, we're the only private company in the nation doing this at this time.
Wayne, I really appreciate the overview. I think it's so helpful to know that distinction between the full model of concierge and this partial or hybrid model that you're describing, especially as we're hearing more about this concept of concierge medicine. I know you mentioned the company was founded about 20 years ago, and I feel as though in the last few years, I've certainly seen this concept pop up quite a bit more. So as healthcare organizations are continuing to navigate some pretty persistent challenges like physician retention, experience, financial sustainability. Can you elaborate on the role that flexible membership medicine can play in creating that resilient and perhaps a more rewarding practice environment?
That's a wonderful question. I'm going to just mention that when we first started 20 years ago, and I talked about concierge care, nobody knew what the term was. They kept thinking that we were in the hospital, in the hospitality business, and it was what somebody did at the hotel. Nowadays, it's a very, very common phrase, and it's well known as something that's in medicine. But in talking about the flexible models, let's just look at what's going on today. Today, there's tremendous instability in what the future will allow for, especially with government programs, compensation, Medicare and Medicaid, and the insurances have always been unstable. It's always a battle, and also currently grants have been slashed. So a lot of systems that used to rely on certain predictable revenue don't necessarily have that predictability anymore. Furthermore, there's another interesting aspect of what's going on with artificial intelligence, with AI, in the battle for payments. It's even harder and harder now to deal with the payers on claims because they are now using AI as a tool to help maximize their quote unquote efficiency. And frankly, bigger entities can do better with AI than smaller entities. So one of the things that's going on now is that relationship-based care is at an all-time low. But the demand for it is, because of its disappearing in many places, is reached an all-time high. And flexible concierge care really can buffer this whole impact because the source of the money comes from the patient. It's a personal payment. It's not paid for by a third party. This is a real change to the paradigm that most practices are used to. But it also has other impacts that are very, very important to practices. It helps in physician retention. It prolongs careers, in particular because it's so appealing as a professional environment and an opportunity for income. It helps with recruitment efforts. With older physicians, it expands the opportunity for them to continue to be productive in their later years. And so it helps in so many different ways, and it's not always obvious that it's helpful in many different dimensions. Ultimately, the satisfaction is very, very high on the part of the physicians, and nowadays the administrative groups are realizing that there's an opportunity to tap into that asset that exists, that value that exists. So I think the challenge is always there in physician retention, patient experience. With patient experience in particular, patients who are part of this program really, really like it. We survey all the time, and the patient satisfaction is incredibly high. And frankly, even the patients who don't participate find that the practices have improved, and so their satisfaction is greater as well.
Yeah, it's so important to highlight that element of patient satisfaction too. So thank you for doing that, Wayne. And as we're thinking about all these opportunities, not just in patient satisfaction, but as you mentioned, physician retention, prolonged careers, recruitment opportunities. At the same time, efficiency at the practice level is so important for many organizations. So how can flexible membership medicine complement those existing practice structures without disrupting operations? Could you maybe share some examples of what that would look like?
Well, if handled properly, it can be a seamless change. It's not a disruptive. Originally, when people started doing concierge programs, they thought that there'd need to be different facilities, different waiting rooms, separate entrances, a whole variety of amenities that frankly are not that important. What's really important in concierge programs is the availability of the physician. I think that's the word that's key, availability. But in a hybrid program, it only takes a small part of the day, very, very small part of the day. No patients get dismissed in the practice. There definitely is no need to relocate. We've had a number of people say, well, why don't you move to, we'll move this to a different spot. And the truth is relocating is not necessary. There's no need to change or add to staff. Many of our clients have this model. I'm going to give you an example from one of the clients that has a physician with 100 hybrid members, which equates to roughly 150 hours a year or 3 hours a week doing services for these patients. And be aware that even within those 3 hours, if these were traditional patients, they'd still have an hour or so of service time. It's less than 10% of the practice time altogether. And yet it can generate 20 to 25% of the practice revenue without added cost or added staff. I mean, that's pretty amazing. It's not an investment-based change. It's really a paradigm change.
Yeah, absolutely. Those are some pretty compelling numbers. And just curious too, Wayne, among the organizations you've worked with, such as this practice, maybe we can keep going with this example. Are there any other measurable changes or improvements that you've noted as a result of them adopting this flexible model?
Well, the one that's very rewarding is that today, with the kind of pressure that physicians are under in terms of productivity, they aren't necessarily running their careers way late into their latter years. They're looking forward to their retirements, and they're getting out even earlier than they should be. There have been a number of articles about that, but we've seen that it has extended the careers of these seasoned physicians, and that's because they can still be productive and not have to be seeing a very, very large number of patients within a day. It can help them to be productive within their practices and also happy within their practices. So their professional satisfaction is increased and their personal satisfaction increases. We have some doctors who are still practicing into their 80s because they want to, not because they have to. And that's one element that's measurable and obvious. Also, in recruiting new physicians, there are fewer and fewer physicians going into certain areas of medicine. And it's important to be able to compete. And one of the ways you can compete is to offer something that is desirable on the part of the physicians, and yet consistent with what you're trying to accomplish and your strategies within larger groups. So recruiting new physicians is a real benefit, and it's something that's extremely measurable because we're seeing that one group over another in a particular geography may find that it's easier to recruit those patients. Those physicians. And in fact, what's interesting is that you compete for physicians not just in your immediate area, you're competing for them in much broader geographies. And so where there are concierge programs that physicians might be able to do either earlier in their practices or later in their practices, it's an opportunity to make it more desirable to work in that location. And the patient satisfaction, as I said earlier, really is incredibly high. We're very well involved in patient surveys, and we do them in a very effective way. We get a lot of information. And it turns out that the satisfaction rate in the concierge programs is immense. And remember, it's a consumer-based decision. If they're not happy, they don't continue. And so we have to make sure that the patients are getting what they want and the physicians are happy because they don't have to continue necessarily either. So therefore, it's important that it's a win-win, that everybody is satisfied and happy.
Yeah, some great examples, Wayne. Thank you. And that actually leads me nicely into the next thing that I wanted to ask. We're talking so much about this concept of flexibility and what that can do for a practice and for patients. And looking ahead, as patient expectations and physician needs will inevitably continue to change and evolve, how do you see flexible membership medicine really shaping the future of care delivery? And what's exciting you most about that shift?
Well, let me start by talking about what we mean in flexibility. If you were a doctor or you had a doctor in your group that is doing administrative services, it might be valuable for them to offer a full concierge model to a smaller number of patients so that they can continue to devote half their time or a third of their time or whatever portion of their time to their administrative roles. I think it's also important that some doctors consider full models at the latter parts of their years, because that's when their relationships are at a maximum. and their patients usually are a little bit older. They can take advantage of the opportunity that exists, and it's incredibly satisfying to be able to say to a patient something other than, "Is there anything else?" And then, "I'm going to see you next time you're here." To be able to really talk to them and have a discourse on what's going on with them personally, professionally, and medically. But one thing I will talk about for the future is that I think that just about every practice has some opportunity to have hybrid concierge patients. And it doesn't make a difference if you get 100 or you get 10 or you get 150 or 200. Once you get over 200, it gets a little bit more challenging, but it can be done. We have physicians who are doing hybrid programs in larger numbers as well. This is what's important is that it's a shift from relying entirely on third-party revenue. It's taking control of the destiny of the business destiny of these practices. And that control is in being able to set your own price point and set the logical revenue that you rely on, so that if in fact you have a period of time when there's inflation and the costs are going up, you can modify your fees as well to be able to support that change. One of the things about flexible programs like this that people don't often understand is that we've done this now 20 years. We've gone through recessions. We've gone through good economics and bad economics points. And frankly, this is very, very stable. The revenue is not interrupted when someone goes on vacation or there's a seasonality to it. The revenue is consistent, and that's what a lot of businesses have recognized, that membership is a way to have recurring, consistent, predictable revenue. And so this in a flexible way allows practices and systems and larger groups to continue to be able to benefit from the referrals, to benefit on the testing, to benefit on the secondary services, tertiary and quaternary services. The benefit here is that this is not a revolution, it's an evolution, and it makes so much sense because there really isn't, there aren't as many places for full models. There are some, but there are definitely lots of places for hybrid models. And I think the other challenge is that this is an opportunity that requires a lot of understanding of the many variables and strategies involved, because whether you do a full model, a hybrid model, whether you do it with assistance, without assistance, with additional doctors as a group strategy or a location strategy, it's not an easy thing to figure out how to do. In fact, one of the more subtle pieces of it is what's called buy-in. When you do this in a larger system, you have to have first buy-in at the management level, then you have to have buy-in at the doctor level, then you have to have buy-in on the patient level. And so setting it up properly will achieve that buy-in that's absolutely necessary, because in recurring revenue, what you want is the word recurring. You want it to continue. You don't want it to dissolve after the first year. I think that reinventing the wheel causes landmines. We've learned about all the landmines over the 20 years, and we've figured out the ways to avoid them. And we've also figured out the ways to improve the effectiveness. Sometimes I talk about the fact that there's a gold mine out there, that every practice with relationships has the opportunity to mine that gold. And you can do it, and you can do it with a spoon, or you can do it with a steam shovel. The point is that you only get one bite at the apple. And that one bite of the apple is very, very important to do it properly. So I see this as exciting because I think just about every practice can consider it, and just about everybody can do it in some way, shape, or form, particularly in primary care and sometimes in specialty care.
Mm. Yeah, I definitely hear the excitement behind it, Wayne, and I really appreciate you kind of giving us this future forward outlook on concierge medicine and the opportunities here. And I know we've covered a lot of ground in our discussion, but is there anything we didn't touch on or any final thoughts you wanted to share with listeners?
Well, I can talk about this stuff for hours, which I know that very few people are going to want to listen that long. But we've done this for 20 years, and you know, we're not new at this. One thing I would talk about is time. Time can kill an opportunity because you're in a competitive world, and the opportunities are out there now. Now it's acceptable, it's common, it's more available, it's on the tip of the tongue of many, many people. It's time for and time. I know, for instance, in large systems, because we've worked with some of the biggest systems in the country, it takes a long time to get from point A to point B. Sometimes it's necessary, sometimes it's just a matter of sitting back a bit too long. It's important that the people out there who are listening understand that this might be the time for them to jump into this, to work into this, and it's very important to work with experienced professionals when launching this kind of a program. So my hope is that as we look forward the next couple of years, we see that more and more physicians are offering hybrids, some full models, and that it helps stabilize a lot of what's going on in healthcare at this time. So with that, I want to thank you, Erica, for talking with me. I want to thank Becker's for hosting. And I hope to see, I'll be going to the annual meeting in Chicago at the end of April, and I hope to see many of you there at that time. So thanks again.
Fantastic, Wayne. Thank you. I'm so glad to hear you'll be at annual meeting, and I can't thank you enough for all the insights you shared with our listeners today. A lot to consider here, and we hope to have you back on the podcast again sometime soon. Thanks so much again.
Look